Good evening, good evening, good evening, and welcome to Couch Conversations with the Doctors, where health is wealth. What night is it tonight? It is Monday night, and it is time for Couch Conversations with the Doctors. As we go around, we will be introducing our esteemed panel, as we always do, starting with my coworker who tends to leave me and go and have fun in the sun. However, it is so hot outside today until flip-flops are melting. Go right ahead, Doug.
Well, I hear you about the heat, Nikki. I'm a retired physician. I worked for 30 years in the western suburbs, and after retiring, I went to work in the congressman's office for 2 years. And I learned a lot about healthcare policy and about healthcare equity. It's a real honor to be here with my colleagues, and I'm going to try and answer your questions as best I can.
Outstanding, and thank you so very much to the man who is just the guru of all things, but he is also a art connoisseur. That's our very own Joseph Harrington. Joe.
Thank you much. Thank you very much, Nikki. I appreciate the accolades. Well, my background is primarily in public health and healthcare, although I've worked in mental health education, but mostly public health and healthcare. I retired in 2017 from the Illinois Department of Public Health, where I was the regional health officer for Cook County and an administrative law judge, and I know just enough to be a problem.
Very good. That's called good trouble, I believe it is. Want to say hey to Allison Johnson, who is here with us. Want to say hey to Tesa Anuwinski, who is the CEO of Loretta Hospital, who is here watching with us just as well. To Trish, who is here also. Hey, Trish, how are you? Renelle Perry is here with us on this evening, and she's saying hey to the congressman. So hey, Renelle, how are you? We also have Alderman Pat Dow, who is here with us just as well. And she says, come on with the conversation. All right, we are coming to the doctor that's known on these streets as Dr. 100, because she keeps it real. That's our very own Dr. Maya Green. Dr. Green.
Hello to community. Hello to my wonderful colleagues. I'm Dr. Maya, always keeping it 100. My birthday is coming up, so shout out to all the Virgos. And this year, I'm promising to go 100 on our community's health. And so I'm excited to be part of this and many more conversations. So let's go.
Outstanding. I want to say hey to Johnny Diggs, who is here with us. Hey, Johnny, how are you? To Evelyn Green from the Chicago Department of Public Health, who is here. And to A.V. King, that's Antonio King, who is here just as well. Thank you. I want to say hey to Catherine Jones, who is here. She says good evening to everyone, to that weight loss guru, that family practice medicine physician. But he's really thinks he's the Wolfgang Puck of cuisine. That's our very own Dr. Tony Hampton. Dr. Hampton.
Thank you, Nikki. Happy to be here, and always excited to share the food as health message. And I'm with Advocate Health on the south side of Chicago, family medicine, obesity medicine, and a focus on wellness. So I'm happy to be here and looking forward to our conversation.
Outstanding. I want to say hey to Dr. Marvin Jackson, who is here, to LaMonica Jones, who is here, and the staff over at University of Chicago that is working, but they are watching. Want to say hey to our great friends over at the Core Center, who is working, but they are watching, and they asking a question, where is Pete? So, Pete is coming. So I want to say hey to the Core Center, who is here just as well. I want to say hey to Carol Bell. Hey, Kay, how are you? How are you doing on today? To Karen Scott and Lolita Travis, who are here. That's Professor Scott. I want to say hey to you just as well. To our doctor, who is a integrative medicine specialist. She is simply phenomenal and outstanding, but she is a fashion connoisseur. That's our very own Dr. Wilson. Dr. Wilson, why don't you introduce yourself to everybody?
Good evening, everyone. My name is Dr. Danica Wilson. I'm currently the medical director at Abraxas Southwood, and we specialize there in addiction medicine. And previously, before that, I was medical director at AHF, AIDS Healthcare Foundation, for 6 years. I'm glad to be here. Thank you for the invite.
Outstanding, outstanding. Want to say hey to Audrey Tanksley, the president of the Cook County Physicians Association, who is hanging out with us just as well. Hey, Audrey, how are you? Well, we have an additional guest with us on today, who is the executive director of the Southwoods Interventions just as well. That's Shelton Colbert. However, even though he was raised in Pittsburgh, Pennsylvania, and he is now a Chicagoan. He's been here maybe a couple months, so he's getting his feet wet. He has always been a diehard Chicago Bears fan. Come on, Shelton, why don't you introduce yourself to everyone?
Good evening, everyone. First of all, let me say it's a pleasure to be in this company this evening. I'm so excited about the topic we're discussing tonight. I'm so excited about all the great minds that are brought together that I can learn and share and grow my own aspect this evening. It's really, really a pleasure to be here. Pleasure to be in Chicago as well. I came to Chicago as a consultant back in March, fell in love with the city, and found a way to stay here permanently. So excited about my new life here. Thank you very much for having me.
Outstanding. And thank you. Want to say hey to Diane Lewis from the Chicago Defender who is here. What? Okay, I see your messages coming through. We see you here. No problem. Want to say hey to Linda Johnson. Linda Johnson says, good evening. Good evening to everyone. Good evening. And Catherine Jones says, yes, yes, yes. We need this information. Well, to the man who makes this possible for us each and every Monday night, to the one who teaches us that true wealth is health. It's the Congressman of the Illinois 7th Congressional District, the vanguard of healthcare, our very own Congressman Danny K. Davis. Congressman?
Well, let me thank all of you and all of us for being present. Dr. Colbert, let me welcome you to the city of Chicago. Pittsburgh is a great city and a great place. And I used to always love reading the Pittsburgh Courier newspaper when I was a kid and afterwards. And it's always good when I was in Pennsylvania for whatever. But also, I'm pretty excited because we have just come off of two great events in our city. One is the Bud Billiken Parade that was just a couple weeks ago. And with it being the largest continuous Black parade in the United States of America. And not that the parade in and of itself has meant nearly as much as the contributions to Black culture, Black politics, Black growth and development as the Chicago Defender newspaper and the role that it has played in helping shape the lives of Black people, especially all over America. So I just wanted to mention that one thing. And then, of course, the Democratic showpiece, the convention. Conventions are ways of people patting themselves on the back, looking at what they have accomplished, hoping for what they will accomplish, and the fact that Chicago, the eyes of the world, were focused for 4 days on Chicago, Illinois, a city founded by an African American fella and a Native American wife. The two of them shaped the development of business in this area, trading posts that ultimately became Chicago. And our country has been changing and changing and changing. Native Americans had somebody called a medicine man. And so no matter what culture, what period we're talking about, there's always the need and always has been the need. I discovered from reading the Bible that sometimes when people had disorders way back, they'd take them out in the woods and leave them. Or even when people had leprosy, they'd take them out. And so behavior health, the need to try and understand better. I visited a place this morning called Covenant House and was so tremendously impressed until it's not funny. They are a resource for homeless children who have been traumatized, who in many instances are simply homeless with no place to go. It's on West Lake Street, and I've been hyped up ever since I left them because of the tremendous resource that they are for young people who've had trauma in their lives, who have no place else to be, no place to go. So let's get it on. Thank you all. And it's a good way to start a Monday.
All right, I want to say hey to Marshall Oliver, who is here with us. Hey, Marshall. To Louis Carr, who is here with us. And to Mimi Brave Boy, who is here. Mimi says hey to the congressman. Now, I'm going to read the title that the people sent. It says, good evening, and thank you for your show. I watch every Monday. I am a part of Republicans for Harris because character matters. So just want to say hello because they're saying hello to us. Hey to Tracy Good, who is here with us. Hey, Tracy, and thanks for joining us every night. I want to say hey to President David Sanders of Malcolm X College, who is here with us just as well watching. He says, I am ready for this conversation. Well, we are ready for you to be here with us just as well. I want to say hey to Kimberly Alexander Jackson. That's Kim Jackson, our very own Kim Jackson. To Rosetta Guy, who is here. And she says, good evening, Congressman Danny K. Davis and everyone else. Well, the Center of Disease Control and Prevention reports that there are the hardest hitters of drug overdoses since 2021. And they give a list of the top 10 states, from Virginia to Tennessee to Louisiana, but Illinois comes in at number 4. So we have our great panelist here that's going to tell us why synthetic opioids deaths in Illinois have increased by over 3,000 and how they can work to help you over at the Southland. I don't know which one of you want to start. Shelton, if you want to start, or if Danica, if you want to start, it's up to you guys. Take it away.
I'll be a gentleman and let Danica start, and then I'll chime in afterwards.
Oh, okay. Awesome. So, to answer your initial question about the deaths, so one thing that we are noticing is that much of the opioids or the heroin that is out on the streets now is not truly heroin. So, a lot of it is mixed and cut with different substances. One of those substances is fentanyl, and fentanyl is the main substance that is causing respiratory distress in many of the patients and overdosing more than they typically would on heroin. There's also another substance that's being mixed into the heroin called xylazine, which is an animal tranquilizer. So it started initially in Puerto Rico. However, it has, of course, made its way over to the mainland US and is being mixed with a lot of the street heroin that's being produced. So a lot of times when the patients come into our facility at Southwood and we actually do a urine drop on them, they're actually testing negative for the actual heroin and testing positive for either the fentanyl or the xylazine and or both.
Cancel Dr. Ametrist Johnson.
So therefore, a lot of them are actually have a lot of friends that are overdosing, a lot of family members are overdosing, mainly because they feel as if what they're getting off the streets now and what they're getting from their dealers is not actually heroin, but is fentanyl. So when they come in and you say, hey, what's your drug of choice? They just immediately say fentanyl, whether they feel like, they've actually purchased fentanyl or not. So with the increase of that, and it's not being, as the patients would say, true heroin, that is causing much of the respiratory distress and the lack of the ability of people knowing about Narcan, which can help bring a lot of those back who we catch in the middle, or who you don't have to be a doctor to necessarily catch anybody or to see anyone having an overdose. It's just having the accessibility of the Narcan and knowing how to use it. So Shelton, I'll turn it over to you.
Dr. Wilson made a great point there that cannot be emphasize enough. A lot of the narcotics that are on the street today, the user of that narcotic has no idea what they're getting a hold of. And that's what, as she said, that leads to a lot of the respiratory distress. That's led to the increase in deaths here in the state of Illinois and also throughout the United States. And one of the things that we hear from our patients so often is they don't have the ability to go through the withdrawal symptoms successfully. They want to fight the urge to get sick, and that's where the problem leads to them wanting to keep using because they don't want to go through the pain that is caused even with the MAT of withdrawing from the opioids. That's just how big of a grip they have on people.
Let me ask if I could, are there any profiles? I used to work for a psychiatrist, Dr. Kermit T. Mellinger. And of course, at the time that Kermit was still alive and working, there were 6 Black psychiatrists in Chicago. At that time, there were only 6. And of course, he was a very brave guy, because he slipped and started. And when I say slipped, without the approval of the board of the outfit that we worked for, he started a methadone maintenance program. And sometimes he would have to slip away from his clients. I'm saying they would just follow him. He'd be someplace and have to go out the back door. He was also a professor at the medical school. He also was working at Sinai Hospital and the VA hospital and had clients and all of this. Individuals who know that in all likelihood they're going to harm themselves, do they not have the whatever it takes to really go through trying to get off?
Would you like to go first, Dr. Wilson, or would you like me to answer?
I can go first.
Thank you.
It's not, I don't think that it's that the patients don't want to get off. As Shelton mentioned, the symptoms of withdrawing can be very distressing to someone. So they go through hot and cold sweats, stomach cramps, muscle aches all over their body, nose running, watery eyes. So they're at a point where they're so uncomfortable and in so much pain and distress that, as Shelton mentioned before, they would rather just use or have some methadone to keep them from going through those symptoms. And I think that's the biggest fear for a lot of the patients, as was stated before, as to why they continue to use. But now, outside of that, the biggest fear is actually overdosing, because they are taking, fentanyl versus the actual heroin. When the patients are overdosing, I mean, they're vomiting, diarrhea uncontrollably. So it's very distressing, to the point that sometimes even when you're taking a history, they're unable to talk because they are in such distress. So they're laying in a fetal position, sweating. And so a lot of them would just rather use because they know what symptoms are coming up. So that's part of the reason, I would say. But just like any other addiction, that craving for the actual drug sometimes just takes over the actual desire to actually seek treatment.
And what I would add to what Dr. Wilson has said, we know that from the medical model that addiction is a chronic illness. It's a disease. It's just like many of the other medical models of disease, such as high blood pressure, diabetes, and things of that nature. And when you start to look at the disease from that aspect, you begin to understand that even someone with high blood pressure doesn't exercise as they should, doesn't eat the way they should, doesn't take their medication the way they should. So those things that are similar to other chronic diseases are also similar to that in the person who's suffering from chemical dependency. And I think in America, we need to start to frame the conversation that this is a disease, this is a chronic disease, and it must be treated in a way that when people who, just like normal people who struggle with keeping their blood pressure under control, keeping their sugar levels, A1Cs under control, and those with chemical dependency also struggle with keeping their cravings under control. They struggle with keeping their lifestyle issues. They struggle with not only what they're doing, but what has happened to them. There are just so many different variables that go into chemical dependency that we need to frame the conversation around.
And just to add to what Shelton said, a lot of it is also self-medicating for undiagnosed or untreated mental health. So it just kind of goes hand in hand. And just as he said, with high blood pressure and other chronic diseases, it's just easier to kind of continue to do what you do, you know, just like he mentioned with high blood pressure. So it will be a hassle or more of something to work on for someone to change their diet and to exercise. And so, as he stated, addiction is a lifelong process of changing of behaviors and modifying behaviors. So sometimes it's just easier to do what you've been doing. And a lot of us, a lot of people in general, not especially African Americans, are against seeking mental health. So it's difficult to try to tell someone that they actually probably need to seek that type of medical care versus turning to the drug that they're using.
Well, Joe, I see you have your hand up.
I wanted to provide some context. I think the first thing, and I got three things. The first thing is, if you smoke cigarettes, you have an addiction. So people understand addiction, but they don't also always think about smoking as an addiction. And some people are addicted to alcohol. Alcohol is a substance, and some people are alcoholics and they're addicted. So it's not something that's unusual, but we usually tend to think about substance abuse as other kinds of things and other drugs that people ingest. But if you smoke to excess or if you drink to excess, you have an addiction. So I just want to just demystify to some degree this issue of addiction. The other thing is I looked for and I found a definition for substance use disorder. And I think that breaks it down a different way. It describes it as a treatable mental disorder that affects a person's brain and behavior, leading to their inability to control their use of substances like legal or illegal drugs, alcohol, or medications. These symptoms can be moderate to severe, with an addiction being the most severe form of substance use disorder. I also want to offer up that there is the Substance Abuse and Mental Health Services Administration has a 24/7, 365-day a year treatment, referral, and information service. And they do have a hotline. That number is 1-800-662-HELP, 1-800-662-HELP.
Outstanding, Jill, and thank you so very much. I want to say hey to Terry Johnson, who's here, and Trina Johnson is here just as well. Hey, Trina. Sandell Scott is here, and Pamela Dominguez is here just as well. Michelle Garrison is here also. Tony, I think you were getting ready to say something before I read that question.
Yeah, I just want to do exactly what Joseph just did, which is reframe this just a little bit. I'm just speaking from a frontline doctor who works in clinic, and I may not be taking care of a ton of people who are, in treatment for addiction, although I do take care of some. But I do want to do the same thing he just did. The addiction that the metabolic health doc takes care of the most is carb addiction. So I just want to say that the same neurons that make you addicted to heroin and cocaine are the same ones. So if you have an addiction tendency, even to a drug, you have an addiction tendency, because we tend to replace them. So we'll do one drug and then say, I'm going to do better and I'm going to go to this. I'm not going to do the illicit, illegal drugs, and I'm going to get a prescription drug. And then if that's not working, I'm going to do the alcohol. The same criteria for alcohol addiction is what we use for processed food addiction. The exact same 11 criteria. So I just want to say that. But more importantly, I want to say that a lot of people are hearing this conversation. They're saying, this is not me. This has nothing to do with me. These are people that I see when I walk, when, the people that you're, asking for money when I'm at the light. No, this is many of our friends and family. And I just looked up the CDC, and they went back to 21. They said 100,000 deaths annually from drug overdose. But more importantly, many of those people, if not most, are from prescription overdose. So that's when my health system had to change how they approach it, so that they micromanage us to death, partly because they want to make sure that people are healthy and well cared for, but we also don't want to get sued because we have irresponsible prescribing practices. So when people come see me in the clinic, I have to ask them about their family history. So if they have a family history of substance abuse, they have a higher risk. I have to ask them about their personal history of substance abuse. And of course, as mentioned by Dr. Wilson, I think their psychological profile. So if you have a mental health issue, you're more likely to be at risk for becoming addicted or overusing drugs. The other thing we have to do is if you're at risk for sleep apnea, because as you know, many of these drugs are depressant. So if I get a drug that's going to depress my ability to breathe and I have sleep apnea, now my risk is even higher. So I'm asking them about, are you tired after you wake up? Still tired? Are you snoring? Do you have any issues? Stop breathing at night. And if they have these types of things, if they have a thick neck, being a male, all of these things put you at risk. So when people come see me, I have to think about naloxone. So if you're getting a hydrocodone or oxycodone, et cetera, you're probably going to get a prescription for a naloxone as well. So that if you take too much, your family members can assist you. You're going to have to do a urine screen every year. And of course, we have to document in our chart that you are on a treatment plan. We have to put the diagnosis. So it's and we can only give you a week's supply when you first start these strong medicines. So I just want to put on the table that this is not just the drugs you see on the streets per se. It's actually the pain medicines that many of our friends and family are taking.
Well, outstanding. Go ahead, Congressman.
How do people usually get started? What are prevention? We often talk about prevention being worth much more than a pound of cure. Is there any way to prevent or keep people from beginning to use these substances that become overused?
Well, there are various entry points to addiction. One being we look at marijuana and we consider that a gateway drug, where a young person might start smoking a few joints here and there, and then as life goes on, they get into harder and harder drugs. Another entry point is what Dr. Tony was just referring to, was people get prescribed a medication, a pain medication, to manage their pain, and then they begin to abuse and use that. Then there are also traumatic life events that lead, trauma or some type of mental health that people are trying to self-medicate, as Dr. Wilson alluded to earlier. There are various ways that people come to addiction, and there are various ways that people stay stuck in addiction as well. So those are just probably the three main ones.
And I know this isn't, but it seems to me that since we know that marijuana is a gateway. I mean, how do we rationalize the fact that it's legal, it's promoted, it's whatever it is, it is all those things.
Yeah, that's a difficult question for me because I never thought that we as a society or government should have started the legalization of marijuana simply because of the road it potentially leads down for people. But um, as an addiction professional, that's just one of the things that came about in society that we just had to deal with. Much like the opioid crisis that we experienced in the Appalachia part of the country, where we were just helping coal miners to wrestle with their pain, and it turned into something far and above and beyond what we ever would have thought it would turn to. Um, Marijuana, although it does have medicinal properties, and I don't want to debate that in this hour, but I just think it causes more harm than good to our young people.
Hello. If we haven't, I'd just like to kind of underscore what everyone said. First, I want to give a shout out to the Chicago Department of Public Health and the Chicago Methamphetamine Task Force. Now, methamphetamine is different from fentanyl, but one of the things that we're doing is we are looking and educating people about fentanyl. So, shout out to Antonio King and Dr. Keith Green, who have driven these efforts. So just to underscore what everyone's talking about, and I'll be quick, fentanyl essentially is a pain blocker. Fentanyl was created by Paul Hansen, who's over the Hansen Pharmaceutical Company, and it was created as a surgical anesthetic in 1960s. What it does is, if this is one neuron and this is the other, if I have pain, it lets all this stuff, all these chemicals go to say, hey, there's pain there. Once fentanyl, so that's the normal course. What fentanyl does is block it. Fentanyl can be up to 50 times more powerful than heroin, up to 100 times more powerful than morphine because it crosses, unlike other stuff, the blood-brain barrier. Okay? And so, other than that, what I want you to know about fentanyl before we go, we talked about things that led to fentanyl use or substance use. Adverse childhood experiences. I know I keep bringing this up. It's a 10-part questionnaire. Usually, it asks you if one of your family members are in jail, if you experience a family member that had drug or substance use. Why? Because people that have family members that experience substance use disorder, a lot of times they're 40 to 60% more likely to experience substance use disorder themselves. It asks you a couple of more questions, whether you saw your parent being hit or kicked. It's 10 questions. If you score, studies show if you score a 4 or higher, your likelihood of having substance use, depression, and those things drastically increase. What does that look like for political determinants of health? In Cook County, it's online. You ain't got to ask me. Go online, Cook County Health and Cook County, Illinois.gov. African Americans made up 56% of opioid overdoses. Latin Americans, 15%. Whites, 27%. 27% of the people that experience substance use disorder, overdoses from opioids, were from 50 to 59 years of age. And we talked about things that you can do, like if it's prevalent in certain communities, I just read those stats about who's dying. What's the solution? People mention Narcan. Now, I keep my Narcan close because just like everybody in my community, I believe it can happen to me or somebody I love. Right? Y'all saw me. I didn't move. I just reached down. Y'all saw me reach down. Let me grab my Narcan out of my book bag that I carry every day. Let's talk about how to use it, because if you ever have to use it, I want you to know how to use it. You see this pink thing right here? If this is the letter N, y'all see that letter N? I put my thumb in there and I put my first finger and middle finger on each side, and I just lay the person flat, squirt, give them their dose, turn them on the side. Dr. Wilson already told you a lot of times there's vomiting and other stuff, right? And then you call 911. You usually need more than one of these because it wears off a lot slow. I mean, it wears off a lot quicker than substances do, right? But you call 911, you got it under control. Now, I'm a doctor. You don't have to be a doctor to know how to use this. There are Narcan vending machines and places around the city of Chicago where you can get some Narcan to help your loved ones, protect your tribe, right? When we talk about primary prevention, secondary prevention, tertiary, primary, we're doing the things that the Congressman mentioned. How do we change those adverse childhood experiences to lessen the likelihood that someone's going to want to escape their surroundings, take away that emotional pain, mental pain, right? And make them less likely to use. Now, if we have somebody that's gone down that path, I'm gonna check if they're not breathing. If those things are happening, I'm gonna pull out my Narcan just like I did. Reach down, pull it out. I'm gonna squirt, turn them on the side, call 911. I will put in the chat where you can get Narcan around the city of Chicago. There's also something called fentanyl test strips. So you can know if a solution that you have has fentanyl in it. I want you to know that fentanyl test strips sometimes don't work if it's in a solid form, right? So you can crush part of it, change it to liquid, and then you can see. So fentanyl test strips do not work if it's in a pill, a solid form. You have to crush it, make it a liquid form, and then put the fentanyl. It works in liquid form. Okay. I got a lot more, but I know we got experts here. I'm gonna put myself on pause.
Maya, I want to have a follow-up question for you.
Yeah.
I don't know, you may have said that you said squirt. Where do you squirt it?
Oh, sorry. Thank you so much. You go like this, put it in nose, and you go like this. Squirt. The pink thing is down when you first get it. To make the pink thing work, you put it in their nose and watch it push up, watch the pink thing disappear. Squirt like that.
All right. Doug had his hand up. Go ahead, Doug.
So I got another follow-up question, which I think is great. How long does that squirt last? Like if you've got to travel 30 minutes to get to a healthcare center or longer, because you can't carry extras with you.
All right. So make sure you have some extras.
Okay. So
go ahead.
Okay, go ahead, Maya, since you started the whole Narcan.
No, Dr. Wilson.
No,
You're
go ahead.
expert. I'm honored. Okay. So some of them, I've seen them last until, remember, you're not taking the person to the hospital. I just want to dispel that. I'm calling 911, right? I'm keeping more with me. That's why I think they come in packs of 2. Dr. Wilson, mine came in pack of 2. I don't know how many, but I carry several packs. I've seen them wear off as soon as 5 minutes. I've seen them last 10 minutes. I would assume 2 to 4 minutes. That's what I've been assuming, 2 to 4 minutes. That's why I keep more than one, just like you said, Dr. Graham, and I monitor if the person is kind of going back out. You squirt, you turn them on the side, call 911, you back up. A lot of times when people come out of that space, they'll come out thrashing and, and things like that. So you back up, call 911. But you still monitor. You don't back up and leave. You still monitor, because if they start to get those symptoms and stop breathing and slow down again, you need another squirt.
Mike, another question. Well, it's not really a question. So this is a rhetorical question. So if you're living with someone that's suffering some substance use disorder and they may use Narcan, is it better to go look for it or have some in the house?
Have some in the house.
And it's free. And you can get Narcan for free. It is free. So it is no cost to save a life. You can do it for free. Well, I want to say hey to Deborah Williams, who is here, to Upendu Parker, who is here, to Karen Castleberry, who is here. Well, Deborah Williams says, Dr. Tony, you had to bring up other addictions like Dr. Pete did last week. Lay off the Doritos. We already know that Dr. Pete talked about Doritos being addictive last week and to leave them Doritos alone. So leave them alone. So we have Isaac Lewis, who has a question for Dr. Maya Green, but he also says that there can be so many other addictions, such as gambling and shopping. If someone chooses to shop and not pay their mortgage, we should foresee that as a problem just as well. And you're absolutely right, Isaac. You are right. But Isaac is asking if Dr. Maya or if Dr. Danica could explain how more addictive sugar is than some of the narcotics that we have. Don't you all answer at one time. Come on.
I mean, I can, Dr.
Go ahead,
Danica.
Maya. Go ahead.
No, have at it. Have at it. Get it, sis.
I mean, just like you said, I believe Isaac, anything, and I cannot remember. It might have been Dr. Joseph that alluded to, or it may have been Dr. Tone that alluded to that anything can be an addiction. Anything. So a lot of times when we think about sugar, we don't actually know what sugar is in what products. So we can look at something and just because it does not say the word sugar, we automatically assume that it doesn't contain sugar. But of course, sugar can have many, many different names when we look at the ingredients. And like you said, sugar can be addictive. I mean, me personally, I can eat a gummy bear, gummy worm, and just keep eating them, keep eating them, keep eating them. So, I mean, you know, I can't give you any stats on that, but we also need to remember too that anytime that we eat any type of carbohydrates, and Dr. Tony talked about that as well, or mentioned that when those carbohydrates break down in our body, they also turn to sugar. So a lot of times we can also, so if you add like those little Crystal Light packs or things of that nature, so it's a lot of different things that contain sugar that we don't even understand or know because we're not looking. And a lot of times the laypersons don't really know that a lot of the manufacturers, like I said, put different types of ingredients in that actually contain sugar. So if someone is craving sugar, it does not necessarily have to be in candy. So a lot of times when people drink too much pop, or people are always drinking iced teas and things of that nature, they may think that just because it's a liquid or it's not a soda, a lot of sugars are in different types of juices, fruits, and a lot of the things that we intake. So the addiction can start there just because we're not watching what we're eating or drinking.
So Danica, he also asked, why is it that sometimes people who have substance abuse tend to eat more candy in the middle of their highs?
Okay. Can't necessarily say that, but I think, I have not witnessed that per se, but I guess it's also just like someone who smokes, right? So if somebody smokes, when they try to quit smoking, what do? Sometimes some things are an oral fixation or you need something to concentrate on. So that may be part of the reason, but you need, I think Dr. Tony said it, we always want to exchange one habit for another habit or one addiction for another addiction. So that is also probably the case. They're trying to find some type of way to distract their mind and concentrate on something else versus the actual craving that they're actually having.
Yeah, I
Dr.
found a
Danica.
simple.
Go ahead.
All right, Maya, then Joe.
Dr. Danica is absolutely right. Sugar, so dopamine is a happy hormone, right? Sugar is one of the main things that releases that happy hormone and gives us that euphoric rush. It also can act on the same receptors as opioids, right? So when you talk about addiction, they're really talking about addiction, okay? To sugar. There are some studies that show that sugar, let me get this right. Sugar can be more addictive to some people than cocaine and equally addictive as nicotine. So there are some studies that do show that. And one of the reasons why, say someone is addicted to, or I'm sorry, someone is experiencing substance use disorder and drinking alcohol, right? Alcohol causes all these like inhibitions, but then it starts to cause a come down, and they're trying to, like Dr. Wilson said, substitute or supplement that with a rush of dopamine. Go back to what I first said. The quickest and legal way to do it is to eat sugar. So just because we're adults doesn't mean when we eat sugar on the inside, we're not running around like the 2-year-old that we don't want to have sugar. That we still running around on the inside. We just sitting like this on the outside. And that's why sugar is addictive.
And that's also why you shouldn't, if you have an addiction issue, you may not want to take those alternative sugars, although they may not raise your, like if you do one of those little packets that go in your water that doesn't have sugar in it, but it's sweet tasting because it has something like Splenda in it, your brain can't tell the difference. So although it may not spike your sugar and it's good for you if you're trying to keep your diabetes in check, you're still going to want it. And you're going to be thinking about it because it's the same things in your brain. It's in the part of the brain called the limbic system where dopamine is released. And when that dopamine is released, you want to feel that feeling all over again. So it's better for people who have addictions to not drive by Dunkin' Donuts and Krispy Kreme. Take a different route because it's going to trigger the neurons in your brain that are the addictive neurons that were chilling, they were dormant, but then they're going to wake up and say, hey, would you mind stopping by and getting that Long John that you've been craving for? So it is so important that you know who you are. Now, the next person can literally drive by Dunkin' Donuts and it doesn't bother them because they don't have those, they haven't given their brains those addictive neurons that some people have exposed themselves to. And once those addictive neurons are created, which is why substance abuse is a lifelong struggle, they really never go away. They're always there. They can be dormant, but they tend to still exist. Therefore, you always have to use caution when you're thinking about your addictions.
Well, thank
Can I
God.
just add something to that, as Dr. Tony was saying? So kind of what we have mentioned before is that if let's just say some people stress eat or some people stress eat with sugar. So it's the same kind of thing. If we don't find a way to manage our stress or the things that are stressing us, then that could potentially lead to an addiction. So let's just say a lot of people who stress eat, that can also still be considered, an addiction because we're not knowing exactly how to control that behavior when we're stressed.
No, you're
I just
absolutely
want
right,
to,
Joe.
I just want to offer up a quick definition I found for addiction. It's not having control over doing, taking, or using something to the point where it could be harmful to you. If that's addiction, and watching too much television is an addiction for some people. If you can't get your kids to put down their cell phones, maybe it's an addiction. Some addictions are not good, but they're not harmful to your health, or as harmful to your health as others. What we're talking about is some serious addictions that can cause death if you continue or you use too much. And that's what we're really talking about. But addictions is a simple thing. And all of us probably have something that we use habitually, which means it's an addiction, or something that we like to do that could be something, if it was taken away from us, it would change our mood or it would change the way we feel, possibly about life. One of the terms in my early career, when I was in my 20s, I was a community mental health worker for almost 3 years. It was really interesting. One of the terms that I learned, or two terms I learned, one was milieu therapy. And you need to change somebody's environment to give them the opportunity to change. You got to take them out of the environment they're in to get them in an environment where they can change. And there's also this concept of readiness to change. People are not going to change till they're ready to change. So if you're working with somebody that's abusing a substance, until they're ready, and you have to get them to that state of readiness. And that's what psychotherapy does. That's what other things is get a person to understand where they are and get them to the point where they're actually ready to make a change. If they're not ready to make a change, nothing you can do can change.
Well, Joe, that actually leads us into our next question. Even though I have no problems going past a Dunkin' Donuts or a Krispy Kreme, that does not float my boat, but I get a little weak when I go past a shoe store. I get a little weak. I need a little help, a little pull or something, because I believe shoes may be an addiction for me. I really do. Shelton, the next question says, how do we get our families to the point where we can actually assist them? And how does Southland Interventions aid us with our families? It's an anonymous question. Tommy Simmons says, hello to everyone. Go right ahead, Shelton.
Well, piggybacking on what Brother Joe was just saying, a person has to be ready for change. And if they're not ready for change, there's nothing that we can do to force someone. We can't twist arms. We can't blackmail them. It takes an intervention. Um, Chemical addiction is not only a physical problem, it's an emotional problem, it's a spiritual problem. It hits on all levels, and until a person is ready to do that, there's very little that we can do to coerce them into doing so. Going back to what Dr. Maya was saying earlier, if we have a loved one who's struggling with addiction, we have to buy into the harm reduction elements that are out here in the city of Chicago as well as the state of Illinois. We have to be prepared and keep Narcan with us. We have to be prepared that and keep an eye on people in case they do overdose. We have to be there ready to respond to bring them back. We also have to. She talked about the testing strips. We also have to encourage our loved one who's trapped in addiction to use these items, to use the testing strips, even the needles that are available, readily available, so that we're not sharing needles and doing things. There are so many things that we can do to help our loved one other than fret and worry and things of that nature. We have to be able to talk to them openly and honestly about the problem that they have, but also be prepared to intervene in the event of a crisis.
Well, Shelton, Tommy Simmons actually asked the question, well, what do we do about our family members who we love, but they steal from us and they hurt us? What is real tough love, and how do we deal with that? I'm not saying that you guys are not helping. The congressman always has a great conversation, but this is just the guts of things. We have family members who steal from their mothers, steal the dishes out of our homes and sell them. They sell everything that they can put their hands on. They apologize, but it's a real problem. Do we just get rid of this family member? What do? We are trying to have tough love, but it's so hard. And also, we have an additional question that talks about the risky behaviors they have outside of their addiction. So if you guys can tackle those two, that would be great.
Sure. Those are the very tough issues of addiction and family counseling and family therapy. And back in my early career, that's one of the things I did was family therapy, and that question came up so often. When do I give up on my family member? And the truth, I would always tell them, you'll know when you've reached the end of your rope, when you just can't take it anymore. But here's the reality of life. Even if you do give up on that family member, you'll still worry about them. You'll still be concerned about them. That same dread that you feel at night, you'll still feel that. So what I always advise people was to hang in there as long as you can without enabling the addiction. True story. I was out in front of a convenience store today, and the gentleman asked me for money. I told him, I can't enable your addiction, but I gave you my card. And I said, whenever you're ready to get your life together, come by and I'll make sure you have everything you need. Don't worry about clothing. Don't worry about anything. Whatever it is you need, I'll have it there for you. And that's sometimes where we have to get to the place with our family member when they're ready to make that life-changing moment. When they're having that life-changing moment, just tell them, hey, I'll be there for you when you're ready to do life differently. But until then, I'm going to have to leave you to be who you are and to leave you to do what you're doing.
Okay. Joe, you had your hand up?
Yeah. I want to say a couple of things. One, and I was reminded when you asked that question, hurt people hurt people. So those hurt people become hurt people too. And so it's contagious. I mean, just like anything, like a drug. And so I've had members of my family that have had problems with alcohol, with drugs. I never stopped loving them. I was careful about being around them. And I was always prepared to be there if they were ready at that point where they were ready to make a change. And just like Shelton talked about. There will be an opportunity for change at some point, and hopefully somebody is there to help that person turn the corner, because you never know when that opportunity is going to come. So you may be in a position where you may not be able to trust someone. You may be afraid to have them in your home or near you, but you should never say or be in a point where you're not willing to help someone, particularly if they're a loved one or a relative. If they ask for help, you should be there, and you should be there for them.
Let me tell you,
And
I used to work with a group called Operation Bootstrap, and the chairman sometime was a policeman, fellow named George Sims, who was the deputy superintendent of police. And George would say to the guys in the gangs, he says, "Look, I'll do anything in the world I can do for you boys. But if I catch you getting down wrong, nothing will beat you to the police station but the headlights on the car." And so this business of when to give and when to take and when to help, yeah, I think you get to the point where you just make a decision and know that doing the same thing over and over is not going to solve this problem unless somehow or another. Person asked me that this morning, as a matter of fact, and I actually suggested that sometimes your sense of spiritualism or whatever kind of faith that you practice is what it takes to get over that situation. And based on that, you just go ahead and do whatever it is that you do it anyway.
Outstanding. Well, Dr. Wilson, how could someone take advantage of the services that you guys have there? How does that work? You're muted.
okay, thank you. Okay, so I was just talking and didn't realize. Okay, so one of the things that they can do is they can come directly in. We do have walk-ins. Um, we are located at 5708 Southwood Street. That's in Chicago. I'm sorry, 701 Southwood Street. That's in Chicago. And like I said, the walk-ins, we usually tend to take people from very early. They come in between around 6:30, and we take patients up until about 3 o'clock. Would you say, Shelton?
About 3.
Okay. And so, if not, you can also call, and we also schedule appointments. So we have a lot of case managers from different agencies and hospitals and social workers that also call to get patients in. Um, and the phone number to the facility is 773-737-4600. So any, like I said, walk-ins, we have a lot of direct referrals from hospitals. But the easiest way for those that are ready, because as we said before, we never know when someone is ready, or and it's totally up to them, is to just walk in.
Outstanding. And thank you so
Because
very
a lot
much.
of times,
No, go ahead.
no,
Go
I
ahead.
was just gonna say, because a lot of times it's up to the person who's seeking treatment to let them know, let anyone know when they're actually ready.
Well, outstanding, outstanding. Well, Dr. Maya, just want to let you know that Donald Dew says he's going to get a T-shirt that says "Just Squirt" because he is loving the fact that you said "Just Squirt."
Okay.
He also says that you can come
Nice.
over to HSI, or you can give their office a call if it's needed to have Narcan, because they have some there and they actually teach it just as well. Well, I know you guys hate to hear when I say this, because I know you hate it, but it's our time. So with that being said, we're going to go around as always and give our until next Mondays, starting with Doug. Doug, what's your until next Monday?
Well, I really want to thank Dr. Maya for her demonstration of Narcan. and what it looks like and how to use it. I really want to remind people that it doesn't last very long. So if you go to the pharmacy, ask the pharmacist where you can get some. You want some in your car, in your purse, in your locker, at the gym, because you never know when you're going to need it, and you're going to probably need the less too. But thank you, Dr. Meyer, for what you said and did.
Outstanding. Well, Joe, you're until next Monday. You know, Doug's favorite is Maya's Narcan demonstration. What you got? You're muted, Joe.
I'll unmute. I've got two things. First one is if you need help, call 1-800-662-HELP. The last, and I thought about this actually when we started the conversation, I thought about Hebrews 11:1. Now, faith is the substance of things hoped for, the evidence of things not seen. And so I would ask everybody to keep the faith.
Outstanding, outstanding. Well, Doug enjoys Maya's Narcan demonstration. Joe gave you a resource and a scripture, and we have Pastor Cy Fields and Pastor Brooks clapping their hands, sending clapping hands. He said he was waiting on a good scripture tonight. Outstanding. Well, Maya, you're until next Monday, Dr. Maya.
Mr. Harrington, I thought you was gonna quote this scripture that I am, which is Hebrews 12. First I want to say, studies show, because I was like, okay, 2 to 20 or 30 is not a good number. The number on the package of how long a Narcan can last says 30 to 90. I've seen about 5 instances it's lasted about 4 to 10 minutes. So just because on the package it says that, don't mean I can leave that person for 30 minutes. You cannot. You have to watch. Okay, it says 30 to 90 minutes. I just say I've never seen it last that long. Okay, and just to culminate what Mr. Colbert, Dr. Danica was talking about in that last question, there's no easy answer to when a person experiences their course, and those of us that are supporting them, when it is time for us to step back or step up. You know, I just want to speak over everybody listening, no matter what we may be struggling with. Dr. Tony mentioned different types of addictions, sugar, food, Dr. Danica, stress eating. Lay aside every weight, right? Dr. Tony said, no matter what
Come on, Bishop.
Lay aside every weight that easily besets you, the Dunkin' Donuts. He was talking to me. I was like, was you in my car this morning? And run towards the race that's set before you. Not minding somebody else's business, running the race that's set before you. May you lay aside that weight. May I lay aside that Dunkin' Donuts weight. Amen.
that part, Bishop, that part. I'm loving. Go ahead, Joe. Joe, go ahead.
Hebrews 13:5. I will never leave you or forsake you.
All right, we got the preachers in the house. All right. Well, Dr. Tony said he had a patient, but he sent his until next Monday. So Dr. Tony's until next Monday has never become an enabler. Enablers are people who don't help the person they love, but instead they harm them further. So learn how to say no, but when they're ready to make a life change, be there to walk along their side. A great book to teach these principles is Boundaries by Henry Cloud. Thank you so much, Dr. Tony Hampton. Thank you so much. Well, Shelton, you're until next Monday.
I want to capitalize on the DNC right now. We're in the season of hope in America right now. And one of the things that I try to lead by example with at Southwood is not giving up hope, because when we give up hope, we become hopeless. And then we start to give up before the miracle happens. We never know when a person is going to be ready to change their lives. We just always have to be there, willing to help them change their lives. So anyone who has a family member struggling with addiction, I want to encourage you not to give up hope, because soon and very soon, a change is going to come. Thank you for having me. I really appreciated this. This has been the highlight of my time here in Chicago, and I look forward to being a weekly listener now.
Oh, outstanding. And thank you. Well, Dr. Wilson, you got a lot to bring up. Maya had this outstanding performance of how to use Narcan. Doug gave a resource. Joe began to take us to church. And did Shelton, I believe I heard correctly, Shelton gave us a little Sam Cooke verbiage as he was moving towards you. So come on, Dr. Wilson.
So I want to thank everyone for the opportunity to have this conversation, because it is very important. If we don't have the conversation, then that is the first issue of not being able to educate ourselves. Also, I would like to also say that we need to be mindful of being judgmental. Being judgmental can be one of the barriers for people seeking treatment, seeking care, and even confiding in us or you as an individual. A lot of times, one of the big things I like to mention when we talk about, um, tackling anything as it relates to mental health or healthcare in general is that a lot of times we just haphazardly ask people, "How are you doing?" And we are always ready or expecting someone to say, "I'm fine." So just what would you do, or how would you react if someone says, "I'm not fine"? Are you just going to listen? Are you going to give a helping hand? Are you going to give some information that was shared here? What would you do? So just always keep that in mind about also, and like I said, also not being judgmental, because many of us can have, as we stated before, addictions or things that we lean on to when we have those moments of despair.
Outstanding, and thank you so very much. Want to remind you that Congressman Davis has his back to school picnic, parade, World Health Day, and Technology in the Park this Saturday. That's August 31st at Columbus Park. That's this Saturday, the back to school picnic, parade, and World Health Day. Want you guys to come out, grab the resources that are there and put before you so it can help aid you in moving forward and all the great things that you do. Also want to remind you, our heat index for the next couple of days is going to be extremely high. So stay hydrated. And if you don't have to come outside, don't come out. And for those of you who suffer with a little asthma, such as I do, I had a rough time today. So I know some of you did just as well. Make sure that you stay hydrated and take your medications on time, as you always should. And remember, COVID numbers are going up. So let's be COVID wise and all the things that you need to do. If you are in a place and you don't feel that there's herd immunity there, just grab a mask and simply put it on. And that can make things so much better for you. Remember to wash those hands. Dr. Maya usually gives an outstanding educational point on how to wash those hands. So make sure that you wash those hands when necessary so we can all stay healthy. And as always, the gentleman who teaches us that real wealth, if you want to be really rich and happy, is your health. That's our very own Congressman, the Vanguard on Healthcare, Congressman Danny K. Davis. Take us home.
Well, thank you very much, and thank you all. As a matter of fact, let me just reinforce, as Nikki just indicated, we are having our 45th annual back to school picnic and parade on Saturday. We have been doing this parade for 45 years. And it's been great because I run into people all over the country who may not remember anything at all that we've ever passed or how much money may have come into the area, how many billions of dollars we may have helped generate. But they remember that when they was a little kid, they were at the back to school picnic and parade. They were members of Danny's Angels or whatever. So if you're not doing anything Saturday and want to have a little fun, come on out and join with us. And end it off tonight. Let me just suggest that until next Monday, that we go placidly amid the noise and haste, and remember what peace there may be in silence. That's called the Desiderata. As far as possible, without surrender, be on good terms with all persons. Speak your truth quietly and clearly, and listen to others, even the dull and ignorant. They too have their story. Avoid loud and aggressive persons. They are vexations to the spirit. If you compare yourself with others, you may become vain and bitter, but there will always be greater and lesser persons than yourself. Enjoy your achievements as well as your plans. Keep interested in your own career, however humble. It is a real possession in the changing fortunes of time. Exercise caution in your business affairs, for the world is full of trickery. But let this not blind you to what virtue there is in many persons, and strive for high ideas, and everywhere life is full of heroism. Be yourself. Especially do not feign affection, neither be cynical about love, for in the face of all ardidity and disenchantment, it is as perennial as the grass. Take kindly the counsel of the years, gracefully surrendering the things of youth. Nurture strength of spirit to shield you in sudden misfortunes, but do not distress yourself with imaginings. Many fears are born of fatigue and loneliness. Beyond a wholesome discipline, be gentle with yourself. You are a child of the universe, no less than the trees and the stars. You have a right to be here. And whether or not it is clear to you, no doubt the universe is unfolding as it should. Therefore, be at peace with God, whatever you conceive Him to be. And whatever your labors and aspirations in the noisy confusion of life, keep peace with your soul. With all its sham drudgery and broken dreams, it is still a beautiful world. Be careful. Strive to be happy, such as it is, and such as it will be until next Monday. Thank you all for a delightful evening, and we hope to see you somewhere as our paths continue to cross. Have a good night, and thank you. Thank you all.